Pain medicine in the Philippines. The specialty of pain medicine humbly started in the Philippines in 1987 with the formation of the Pain Society of the Philippines by Dr. Senon R. Cruz and colleagues through the guidance of Professor John J. Bonica, himself considered as the father of pain medicine in the world. The Pain Society of the Philippines was one of the earliest chapters in Asia that was recognized by the International Association for the Study of Pain, or IASP. Pain has been defined by a lot of organizations in the past, but the researches and works of IASP brought so much information about pain that it has now evolved into the science and discipline of pain medicine. It is concerned with the prevention, evaluation, treatment, and rehabilitation of patients in pain. It encompasses so many fields in medicine. Sometime in 2006, the Pain Society of the Philippines, through a board resolution, set aside a fund to study the creation of a certifying board in pain medicine, envisioned to be fully independent and distinct from it. A core group of pain management practitioners was organized to form and study the different aspects of a certifying board in pain medicine. The members came from various specialties dealing with pain and who were deemed to be able to work harmoniously with each other. Several workshops were held and some notable models of pain medicine certifying boards from the USA and Australia were reviewed. The documents needed to create a local specialty board were completed and submitted to various government and private institutions for comments. These included the Professional Regulatory Commission, or PRC, the Philippine Medical Association, PMA, and the Philippine Society of Anesthesiologists Incorporated, or PSA. After more than a year, the Philippine Board of Pain Medicine was finally incorporated and registered at the Securities and Exchange Commission. A legal counsel was part of the board that led a group in structuring the newly formed specialty board. A logo was adapted showing the opium poppy, Papaverum somniferum, with the inscriptions Philippine Board of Pain Medicine, and 2007, the year it was finally approved. Several workshops were conducted for the members of the new board. One of these was to train the members of the board to make valid questions for the examinations it will administer. The UPNTTC, through Dr. Jose Alvin P. Mojica, was with the board throughout this tedious task. The board also approved the computer-based examination for potential candidates in order to attract more examinees. Criteria on who will qualify to take the examinations were debated and discussed. Pfizer Philippines offered to provide testing sites and provided IT support for this purpose. This is the first in the country as far as specialty board examinations are concerned. The Conferment Ceremonies last January 2010 formally started the process of professionalizing the practice of pain medicine in the Philippines. On January 2011, the second batch were also conferred the degree of diplomates under the Grandfather's Clause. To ensure accuracy of questions and test construction, the examiners had a dry run in preparation for the online examinations. This was facilitated by Mr. Jericho Aguila, IT expert consultant. 10 successful examinees passed the first online examination, which transpired last November 26, 2011 at Pfizer Library, Makati City. Tonight, we are celebrating the conferment of the third batch of diplomates who passed the first online examinations. These pain specialists will be acknowledged in the medical community. They may serve as a resource person to other physicians in aspects of pain management in a multidisciplinary team. they can confidently coordinate with other healthcare providers towards an improved quality of life of pain patients. A true specialist in the field of medicine in the 21st century.